Hi, my name's Frances Diver. I'm the Chief Executive of Barwon Health. We proposed a project this year to the Geelong Leaders Forum for a group to work on the issue of loneliness, and we were thrilled to have that project accepted, and we've had a group of people working on that issue all year. Loneliness is a key issue for health outcomes. Increasingly in the literature, it's showing that loneliness has an impact on poor health outcomes. But of course, in 2020, it's been a really significant year as the whole of the Victorian community has experienced different levels of restrictions and movements. Loneliness has become even more topical. So we're thrilled to have had that group of people working on the issue and coming up with a really detailed analysis of the literature and some recommendations how we can all help in the Geelong community to draw people together and reduce the impact of loneliness on our community. So thanks very much to the Geelong Leaders Forum. We've been thrilled to work with you. Cheers.
Connection with ourselves and with each other has never been so important as it has now at this time in our lives. Quietly, we ask ourselves, am I lonely? Are you lonely? Are we lonely? What can I do? The famous French philosopher Jean-Paul Sartre once said, if you're lonely when you're alone, you're in bad company. This year of 2020 has been a turbulent, shared journey of self and community for all of us. We have been socially distant and isolated. We have felt so many emotions, all of them valid, all while feeling physically separated. A paradox, we have been far away, yet so close. This project, Loneliness in Geelong, has been a profound experience and an exploration. Together, we face the challenges of remaining connected while unpacking the loneliness situation for our region's young people. We have come to learn and acknowledge the experiential state of loneliness. We have observed and studied it in our community, in our home that we call Geelong. My name is Bree McLennan, and I am here today with my friends, Rebecca Lester, Robert Hodgson, Marie Odell, and Luke Kelly. And together we will tell the story of acknowledging loneliness in our region, in the people around us, and how we can all help our community, in particular our young people, to move toward better connectedness, to encourage leadership and empower the unity in community. Our story begins with a conversation that we had with our project stakeholder, Barwon Health. Internationally, we are seeing more research indicating loneliness plays a role in health outcomes and well-being. There is limited research on this subject in Australia, and we have never explored the situation in the Geelong region until now. This is a Geelong region first in defining loneliness, collecting and analysing relevant data, highlighting its prevalence, identifying contributing factors, describing impacts on physical and mental health, and designing a plan of action to address it. Rob will now talk about the definitions of loneliness.
Thanks, Bree. Loneliness is a subjective experience. It is personal and unique. And it is perceived social isolation, that distressing feeling that your social needs are not being met by the quantity or especially the quality of your relationships. Loneliness is the social equivalent of physical pain, hunger and thirst. The pain of social disconnection and the hunger and thirst for companionship. Everyone experiences loneliness to an extent, but international research is beginning to explore the effects that prolonged loneliness can have on physical and mental health. We know that individuals who experience loneliness are more likely to suffer various adverse health outcomes than those who do not, ranging from a higher incidence of diagnosed depression to both a higher incidence of cardiovascular disease and being almost 3 times more likely to die following discharge from hospitalisation for heart disease. Recent research indicates that loneliness is associated with an increased risk of premature death comparable to that of obesity. The 2 segments of the population most likely to suffer from loneliness are the elderly and the young adults 18 to 24. This young group is the one where loneliness interventions can have the greatest impact particularly over whole of life. We know loneliness is a common problem in Australia. Half of all Australians report feeling lonely occasionally, and a quarter feel lonely each week. For our target group, 1 in 3 young adults in Victoria report problematic levels of loneliness. And we conducted a targeted social media study looking at 1,400 Twitter users across the Greater Geelong region who communicated expressions of loneliness, and we found that more than half of them were reaching out and seeking interaction from other people. And they were more likely to tweet about loneliness in the early morning and in the middle of the week. Rebecca will now extend on the learnings we discovered.
To continue with our data-driven approach, we utilised a large social science survey to identify the key factors associated with reported feelings of loneliness, using the cohort that was most closely aligned with the Geelong region for our target young adult group. Like others, we found that general health and a person's outlook on community and neighbourhood were related to loneliness. What was exciting was that we also identified that a person's work and work conditions of their parents were also important specifically for young people. We found that working irregular hours, particularly varying between weeks, was associated with greater loneliness. Similarly, those whose parents were in poorly paid, insecure or irregular work were more likely to report feeling lonely, as were those who thought that their relationships with their parents was poor. As far as we know, these are new findings and provide an opportunity to target industries where individuals may be more likely to become lonely, as well as to understand why this link occurs. I'll now hand to Marie to tell us about the services available here in Geelong.
Thank you, Rebecca. So we looked at providers in Geelong, and we are well looked after in the community. We invite you to have a look at our report to see the full list of providers in the community. If you have a heart condition, you go and see a cardiologist. But with loneliness, if you experience loneliness, there is no loneliness doctor because it is not a condition. Remember, it is important not to be putting people in a box. There is not one solution for loneliness. It is about focusing on people and their needs. There are different causes for loneliness. You may be experiencing loneliness because you dropped out of school. You may be experiencing loneliness because you're having financial difficulties or because you are unemployed. It is important to identify what is causing loneliness, to reach out and connect to the right providers. Now, Luke is going to talk to you about initiatives that will sustain the work that we have done this year.
Thanks, Marie. Whilst we acknowledge we have only scratched the surface in understanding the extent and impacts of loneliness in the Geelong region, we did make some key connections with a number of individuals and local organisations who are very interested on the subject of loneliness and its impacts on the community. One of our most important partners, who we worked very closely with throughout the project, was Deakin University. Through collaboration with our contact at Deakin, we identified funding pathways to support future research and data collection, focusing on the impacts of loneliness, particularly on young adults in Geelong. In addition to providing a foundation for future research, we also wanted to implement some initiatives that would have positive impacts for the Geelong region right now. As such, we focused on 2 key outcomes. Firstly, we wanted to raise awareness of loneliness in the local community through a set of professionally designed social media posts to be shared on various platforms by key Geelong businesses and community groups. Secondly, we wanted to promote a community-based initiative to encourage action and help reduce loneliness within Geelong, leveraging off an already existing nationally recognised day known as Neighbour Day. Neighbour Day is intended to be an annual celebration of community, encouraging people to connect with those who live in their neighbourhood, encompassing all age groups, instilling the importance of community in young people and helping the elderly and the vulnerable. which I'm sure you can all agree has never been more important than in the current COVID pandemic. Loneliness stems largely around some form of disconnection, whether it be physically or mentally. Improving social connection via community is one of the most accessible and powerful ways to help reduce people experiencing loneliness and isolation. We have consulted with COG and Barwon Health so that they will champion both raising awareness of loneliness and the promotion of Neighbour Day within the Geelong region in 2021 and hopefully for many years to come. But more importantly, we want to ask everyone here today to be a champion in the prevention of loneliness every day. So when you leave here this afternoon, make that effort to reach out to that friend or family member that you haven't heard from in a while who have stopped calling or messaging. Check in on that elderly or vulnerable neighbour. Start up a neighbourhood WhatsApp group. Or if you think you're experiencing feelings of loneliness yourself, don't be ashamed to talk to a friend, family member, or reach out to a local support service. Bree, I'll now hand over to Bree.
Thank you, Luke. We would like to acknowledge our main sponsor, Frances Diver, the Chief Executive Officer at Barwon Health, and Anna Burgess, Executive Director of Strategy and Planning, for their supportive and enthusiastic encouragement throughout the project. The team wants to recognise the significant contributions of Sharon Brennan Olsen, Professor of Social Inclusion at Deakin University, in connecting the work with existing research and ensuring the sustainability of the project. Thank you to all the people who shared their expertise, their insights, and promoted a better understanding of loneliness in Geelong and gave inspiration to potential opportunities. Finally, we want to thank the Committee for Geelong for the opportunity to experience the Leaders for Geelong program. And we want to thank our employers who have supported us throughout the program. And that, my friends, is the story of loneliness in Geelong. I am not alone. You are not alone. We are not alone. We can do something. Together, let's connect and empower the unity in community. Thank you.